CIA. I'll let my co-presenter introduce herself. You might be familiar, but for the sake of formality, go ahead.
Hi, everyone. I'm Juliana Quick. I'm usually on the other side of these meetings, so it's really great to be here and share what WVCI is doing. I work at the West Virginia School of Osteopathic Medicine. I'm an LPC. I serve as a student counselor as well as a learning specialist, and just happy to be here. Oh, and also on WVCI, I have served as the assessment co-chair.
All right, so we'll move into it just to give you some background of who we are and what we do, what we're about. And I see there are a few of our members here attending as well, which is nice to see. But what WVCIA is, it now currently stands for the West Virginia Collegiate Initiative to Advance Healthy Campus Communities. So basically, we are a coalition of representatives from states or colleges and universities across the state, many of which are counselors, but also student affairs, university police, campus security. So we try to have a range of kinds of representatives in different topic areas. We currently have 19 colleges and universities across the state as institutional members, and we have a lot of partners: Wvcia, Bureau for Behavioral Health, West Virginia Prevention Solutions, Governor's Highway Safety. We do a lot of professional development, like trainings, so staff can implement prevention education programs at their campuses. We also provide just technical support and assessments for campus, like the one that provides us the data we're going to go over with today. Technical support, moral support. So if you're interested in learning more, feel free to check out the website and contact us about that. So getting into what the Ncha is, if you don't know, so Ncha stands for, it's the American College Health Association National College Health Assessment. So this is a survey that's done every 2 years. It's very, very broad, like it covers a wide range of health and well-being issues. Our focus today is going to be primarily on substance use and mental health concerns, but it goes over everything from injuries to how often you see the doctor and everything in between. This is a fairly new version. This is only web-based, used to be paper-based. It takes students about 30 to 45 minutes to complete, all completely confidential. This is a list of all the member schools that participated in this survey, the last round that we did. So it was implemented February 1st through April 30th, 2022. WVU, we did our own fall 2021. So for the purpose of getting aggregate data for the state, we just had those two combined together. So that's what you're seeing here today. So in total, across the state, over 26,000 students were invited to take the survey. A little over 2,700 responded, which gives us a sample rate of 10%. And as an incentive, thanks to the Higher Education Policy Commission, we were able to provide some smart TVs, 2 Echo Dots, and 2 Apple AirPods as an incentive prize for participating in the survey. So a little bit about the demographic info of all the respondents. So mostly female respondents, and typically in most surveys I've seen, we tend to get more response from female participants. And as you'll see on every slide, we compare the West Virginia data to the national data. So the green line represents national data, and the typically orange represents the state data of all our info combined. So gender breakdown, about 5% identify as transgender or gender nonconforming. As you can see, not surprisingly, West Virginia is not a particularly diverse state when compared to the national average, and you can see how that breaks down here. So this shows the distribution of what year in school the respondents were. So it's nice to see a fairly even distribution from first year undergrads to doctorates. So that it's nice to get a lot of representation from all the years of school that students could possibly be in. About 8% report being involved in Greek life. About 5% report being involved in some kind of athletics, whether it's NCAA or club sports or intramurals. And just self-reporting of general overall health. we're a little higher than the national average of students reporting that their overall health is very good, slightly lower as reporting excellent. The trend seems to be pretty similar compared to the national average when you look at the whole arc. And feeling of belonging at school, that's something that I think is a priority for all schools, because having a sense of belonging, it not only contributes to the emotional well-being of that student, but it's also good for successful completion in graduation and retention and all that other stuff that administrators focus on with the bottom line. But we want students to have a sense of belonging and purpose and feel they have a good experience at our school. So most students at least somewhat agree to strongly agree that they have a sense of belonging at their school. As far as students perceiving that their schools are prioritizing well-being, still the majority fall in the range of somewhat agree to strongly agree, with a few strongly disagreeing or somewhat disagreeing. And that's pretty much mirrored across the board, nationally. So moving into the substance use section. So this question asks students if they've ever used this substance in their lifetime, whether it's once or every day and anywhere in between. So with the exception of alcohol, the majority of our students are not using other substances. And sometimes that's a modest majority, sometimes it's a vast majority. Even though 73% of students have used alcohol at some point in our life, the data we'll get into later still shows that a solid amount of students are not using alcohol in a high-risk way. But data like this helps us to create positive social norming campaigns, kind of emphasizing that the healthy majority, that most students aren't using alcohol in a high-risk way, most students aren't using other drugs, kind of challenging that misperception that college students often have, where they just assume all their peers are engaging in drug use and high-risk drinking. So challenging that notion is something that's proven effective as far as messaging on college campuses goes. And even though it's acknowledging that, even though it's a relatively low use of prescription drugs and heroin, cocaine, it still accounts for dozens, if in hundreds or more, students across the state. So while statistically it's low, there are still many at-risk students. So we encourage the availability of Narcan, fentanyl testing strips, and all harm reduction efforts that can be implemented on college campuses to the extent that campuses are able to do that. The question of the last time you drank, did you get drunk, and was that your intention? So most students nationally and in the state, they did get drunk. The students who replied that did intend to get drunk got drunk, about 40%. But if you look at this, so this question asks, 5 or more drinks of alcohol. Did you have 5 or more drinks of alcohol the last time you had a drinking session in the last 2 weeks? With 5 drinks being the threshold for what's considered binge drinking. So a good bit of students report that they did not have 5 or more drinks the last time they drank in the past couple weeks, though some did. A struggle with this is 5 drinks for one student and 5 drinks for another student can be a vastly different experience. So it's hard to kind of get granular about the extent to which drinking is going on from one student to another, but it's positive that a lot of students are not drinking that much in the last 2 weeks. This question asks how frequently alcohol has been used in the last 3 months. 10% here in West Virginia report having not used alcohol, and this only includes students who have ever used in their lifetime. So if you've never used, you're not included in this data. So most students fall within the range of it's a weekly thing, or it's once or twice every few months. So the negative experiences related to alcohol use experienced in the last year. This is a breakdown of students who report experiencing these. So for those that are unfamiliar, it was a new concept for me. So what brownout is, A brownout is if you wake up and you don't recall what happened the night before or what you did or what occurred. You don't remember it, but if somebody reminds you, then you remember. You're like, oh yeah, that happened, or how embarrassing, or whatever the case might be. So a brownout is you forget, but you remember if somebody reminds you, versus a blackout, versus even if somebody tells you what happened, you have no recollection at all of it. So that's a new distinction for this survey. Brownout did not used to be an option, but as you can see, that is the most common experience reported by students. You also notice there's a fairly significant increase in the students who reported having unprotected sex after drinking alcohol than compared to the national average. It's hard to say why that is exactly, but I think that is something to take note of. And 3% under the influence of alcohol seriously considered suicide as well. And students were asked if they drove after drinking. So this question was posed only to students who reported driving in the last 30 days. And it doesn't differentiate between, having one drink or having several drinks. But the fact still remains that some number of students are drinking and driving, and that's certainly a risk and something that schools should consider and attempt to curb. Moving on to nicotine. Compared, in a lot of ways, West Virginia is very on par with the national average, but when it comes to nicotine, there's significantly higher nicotine use going on. So there's about 10% more students in West Virginia who report having ever used nicotine than the national average. And let's see, like about 15% more who report being daily or almost daily nicotine users than the national average. And I don't have I can only guess at why that's the case, but it's pretty significant and pretty concerning considering the health consequences that can result. Not surprisingly, e-cigarettes and vapes are the preferred method of nicotine ingestion for students, both nationally and in-state, but still a portion, about 33%, report using cigarettes. A few use little cigars, or smokeless tobacco, but vaping definitely seems to be the go-to for students who use nicotine products. Going on to cannabis use in the last 3 months. So over 10% here in West Virginia report having never used cannabis. So the national average of lifetime cannabis use is higher nationally, and that I would guess that that's related to legalization status from state to state. But the amount of monthly users to daily users is roughly the same as you move into those numbers. And students who use cannabis were asked if cannabis had an impact on academics. 95% reported that it had no impact on academics. And similar thing with alcohol. So 97% of students who use alcohol report that it doesn't have an effect on their academics. It's many people's theory, including myself, that one thing we can help students do, they might not be looking at there are indirect results of drinking alcohol and cannabis. Even after use, your thinking, cognitive ability can be impaired up to 3 days or more afterwards. And other things related to cannabis use and drinking that students might not be seeing as directly having an impact on their academics because it's more indirect. So alcohol affects your sleep. Alcohol and cannabis the withdrawal of that can cause anxiety and stress. And so there's factors that I think it's worth making sure students understand. So that's finishes the substance use portion. So I will move on and hand it over to Juliana. We'll try to leave some time for a couple questions if you do.
So I get to share the mental health data. And I think Wes mentioned this at the beginning, but WVCIA started focused solely on substance use. And our mission over the years has expanded to also include mental health, because we know that a lot of students that are struggling with their substance use may also be struggling with mental health and vice versa. So one of the really cool things about the Ncha, or I think is cool, is that there are several psychological, well-validated psychological scales embedded within the survey. So I'm going to share some of those with you today. So the first one, the Kessler, this is a scale that's used to quickly assess psychological distress and risk of developing a serious mental illness. And so as you can see, the majority of students, 76%, are experiencing moderate to serious psychological distress. And the scale asks questions such as, in the last 30 days, how often did you feel nervous, felt hopeless, felt so sad that nothing could cheer you up, felt worthless, felt like everything was an effort. And so as you can see, we have a lot of students on our campuses that are really having a hard time. And I think, you know, there's a national conversation that is happening right now of, you know, our youth are struggling. And I think this is a trend that started before the pandemic, but has also been exacerbated by the pandemic. So next slide. So these are the types of problems and challenges that students are experiencing, and when you look at this chart, realize that this is frequency. So this was a select all that applies type of question. So as you can see, so students could pick more than one. Most everybody's procrastinating, right? But when we look at what areas are causing the most distress, the top 5 are: number 1, academics; number 2, the death of somebody close to them; 3, finances, career; and number 5, family. Okay, next slide. So another one of these scales is the UCLA loneliness scale. And so this is a scale that measures feelings of loneliness and social isolation. And so it was split right down the middle. And I didn't say this before, but in terms of West Virginia data, we are tracking very closely, sometimes only a few percentage points off with the national average. And so, you know, the reason why I include this is that we know social connection is an important component of mental health and well-being. And I think also on our campuses, we need to be having conversation about coming out of the pandemic of, okay, we proved to ourselves that we could transition everything into the virtual environment. But just because we can, does that mean we should? And so, you know, for example, on my campus, we are continuing to stream lectures live. And so a good portion of medical school, with the exception of labs and seeing patients, can be done from their home. And so I often have conversations with some of my students of like, okay, that are experiencing depression, like, are you getting out of your house? Are you seeing other people? And so I think as a campus community, we need to be having those conversations about how can we support our students for making meaningful connection in real life. Next slide. So another area that WVCIA invests heavily in is suicide prevention. And we do this through training, continuing education, as well as programming. One of our big programs that we offer to our members to get trained as a trainer so that they can take it back to their campus is QPR, which is stands for question, persuade, refer, and it's a SAMHSA evidence-based gatekeeping program. So for this slide, the suicide behavior questionnaire screening is a screening tool that looks at suicidal ideation. It looks at threat of suicide behavior, any suicide attempts, as well as self-reported likelihood of suicide behavior in the future. And so as you can see, I mean, the good news is the majority of students are, reported that they aren't struggling with suicidal And so this is within, so it's both. I see the question of, is this lifetime or within a period of time? So it asks several questions. So one of them is, it's going to ask, have you ever had suicidal thoughts? But then it's going to break it down, and I'll show you the data on this of the last, looking at the last 12 months. So, but we did have 29% of our students that, scored for a positive suicidal screening, meaning that they are at risk. And so 29%, that's 792 students based on our sample. Next slide. So here it's broken down a bit. So looking at the last 12 months, we have about 11% of students that are reporting suicidal ideation often to very often within the last 12 months. Next slide. And in terms of attempted suicide, again, majority of our students have not had a suicide attempt in the last 12 months, but 3% indicate that they did attempt suicide in the last 12 months. And so that's 77 students. And so, I think we know as, working in higher education and working on our campuses, that has ripple effects throughout our whole community. Next slide, please. So transitioning to look at help-seeking behaviors. So good news is that majority of our students indicate that they are open to considering seeking mental health services in the future. In terms of, have you ever accessed mental health services or received these services within the 12 months, the percentages are lower. And so I think we still have some work to do to reduce barriers and continue to really look at how can we encourage our students to get the support that they need. Carolyn often she hosts the counselor director meeting with other people from counseling departments across the state. And she had a guest speaker, Dr. Penny Kuntz from Marshall University, that shared some data, interesting data on racial disparities with mental health. And so one of the things that really resonated was that we have to be more flexible in terms of how we deliver information. So, I can send out as many emails as I want, but it doesn't mean that my students are receiving that information and know about our services. So next slide. So looking at what kind of mental health struggles that our students are facing, the top 3, anxiety, depression, ADHD. And I think that tracks in terms of what I'm seeing in terms of students coming through our doors, as well as talking with my colleagues. Next slide. So looking at treatment. So I was able to do some comparisons. And so I have to show you this slide with a caveat. Ncha, they completely rewrote their survey in the last few years. And so it's really difficult, and you're really not supposed to compare data from the new survey to the old survey. However, I was able to look through the surveys and find that for these variables, the questions were written in exactly the same way for exactly the same time period. And saw some really interesting results in that, and I'm going to show you for anxiety, depression, and ADHD, the number of students, or the percentage of students that are receiving no treatment across the board has decreased, as well as students that are just receiving medication. However, for the students that are receiving therapy as well as medication and therapy, that has doubled across the board in terms of the type of treatment that students are receiving. And I think that tracks with when I talk to a lot of my colleagues across the state of, our counseling centers are working at capacity, and we have had to adjust and be creative in terms of how we serve our students' needs, especially during the pandemic. So next slide, we'll just go through these. So here's treatment for depression in the last 12 months, as well as treatment for ADHD. So as you can see, the categories of therapy and medication and therapy has doubled and beyond. Next slide. So where students are receiving services, so the majority of students are either receiving services at home, back home in their hometown, or they're on campus. And so, you know, we continue to need to work to make sure that our centers are properly staffed and that we have the resources we need in order to support students. So I saw one question in the chat about, is there info on how many of the suicide attempts involved, oh, I can't read the end, substance use. So I don't have that specific data right now, but we could do an analysis looking at substance use as well as suicide attempts. So that's something we can look at, a question we can look at in the future for sure. So some final thoughts just to summarize what we're seeing here is that we're following the national trend and we're seeing a significant amount of students that are really having a hard time. Our students are open and willing to engage in help-seeking behaviors, and so we need to be ready to meet that demand. And, you know, at the risk of sounding cheesy, one of the things I really love about WVCIA and even this group is that, you know, we come from very different aspects of higher education, right? So with WVCIA, I get to sit in the room with a lot of prevention professionals. I have learned so much as a treatment provider, as well as administrators, so that we can all come together to support these students. And so I want you to know this data is available to you. If you're interested in looking through the data, we'd be happy to send you what we have. If you're interested in campus specific data and you don't know your WVCIA representative, all you have to do is email us and we'll connect you to that individual. And if you're interested in the work that we do and our mission, we are always wanting to attract more members. This organization offers a lot of benefits in terms of continuing education training, as well as funding and the ability to bring some of these evidence-based programming to address substance use as well as mental health to our campuses. So we're really lucky in that regard. And so with that being said, I'm going to hand it over to Wes to wrap things up.
Yeah, so yeah, I mean, with everything across the board, like prevention education for substance use, as well as emotional well-being and mental health should be happening long before college. I know to some extent it is, and I think we need to support that and reinforce that. But as far as college campuses, nicotine cessation services, apps, there's all apps available, or create a support group. All of that should be encouraged, because some data that was not included here is I think roughly 30 to 40% have tried to quit nicotine use but failed. So it's like offering support with regard to that is important. And harm reduction, as I mentioned, naloxone distribution, fentanyl test strips, general AOD education when it comes to harm reduction for alcohol, cannabis, prescription drug misuse should be provided to the extent that a campus can. I know there's different resources. Your campus have access to a different level of resources and funds to provide that. And also safer sex supplies and general sex education should be encouraged to the extent the campuses are able as well. So here's if you want to contact the WVCIA Gmail, there it is. If you want to take it down, I think this presentation will be mailed out. We also have a website, wvcia.com. And we really want to thank all of our supporters, Higher Education Policy Commission, who helped put all this state data together, the Governor's Highway Safety Program and West Virginia Prevention Solutions, DHHR, BBH. They help us, they allow us to do what we do. There's some references. So if we have time, if we're able to answer any questions, we're happy to do so.
Thank you both. Yeah, we absolutely have a couple minutes to do some questions. So if anybody would like to unmute and just ask their question or put it in the chat.
So it looks like we covered all the data
was
so thoroughly.
Yeah, no takers. Everybody's being shy today. No, we do appreciate the comments in the chat. It was very good information, and we will be sending the slides around, so you will have that access to the info and to the email address and everything that Wes was talking about.
Thank you.
Okay. We will move on to the discussion topic. So Susie, I actually got your case, so I can share it. So I'll share my screen. You can walk us through it. Just a note about confidentiality, please, whenever we do the discussion topics and we do something that's more specific to a certain student or, client, however you want to designate them, let's be on the up and up like we normally are. No personal information, things like that. So just a quick note about that. And then after Susie's done presenting it, we will then break off into 2 breakout rooms where we should probably get around like 10 to 15 minutes. We'll see how it works out to discuss, come back together as a group. We'll do a very quick kind of like what's the main takeaway or something that was discussed from each group, and then we'll wrap up. Okay. All right. Susie, give me 1 second and then you can take it away. Okay, go for it.
Okay. Well, thank you for asking. I'm glad that our schedule allowed for us to jump on today. Good to see everybody. I did put in the chat our Collegiate Recovery Network website. So currently my position is the program director for the West Virginia Collegiate Recovery Network. For those of you that haven't been on any of our calls or meetings where we've gone a little bit more in depth about what we do. Our program is funded through state opioid response funding right now, and we work with 9 schools to provide peer support specialists at those 9 schools to support students in or seeking recovery. And our definition of recovery is quite broad. So, in addition to substance use, also mental health, situations where students have been impacted by someone else's use, which was one of the other questions I did have for Juliana and Wes, is when you reference the top 5, death and then stress around family members, do we know if those deaths or stress around family members were substance related or that the deaths were overdoses by any chance?
I don't believe it's specific in
Okay.
terms of how it's asked in the survey.
Okay, all right, just curious, thank you. So our peer support specialists are non-clinical, but they are professional staff. So they either are or are in the process of getting their peer recovery certification, which involves training and supervision. So we fill a certain role that is non-clinical, and the other goal is to build that community and that social connection that you were talking about, Juliana. So those are some of the roles that Collegiate Recovery fills, in addition to the harm reduction services, providing the 1 box and access to naloxone, as well as fentanyl testing strips. So if you want more information, you've got my contact information and our website. So this case is an individual who presented for peer support services. And can you make that any bigger, Jay? Awesome. And Carla, feel free to jump in and add anything about this. So background for this person, a 29-year-old first semester student at a community and technical center or school. So they don't have on-campus housing. And this was an initial intake for peer recovery support services. She has been in recovery about 2 years, but without a specific recovery community or pathway. So not engaged with 12-step or Celebrate Recovery or Refuge Recovery or any of the other specific pathways. She presented with recent separation from a domestic partner due to domestic violence and has had unstable housing since leaving the partner. She's living and working at a hotel, basically working at the hotel in exchange to have a place to live. And most of her symptoms are related to anxiety, restlessness, fearful, hypervigilant, some aspects of paranoia, past history that she was diagnosed with anxiety and was treated with medication, but is currently not on medication and doesn't have a provider. She does have insurance and no self-harm, suicidal ideation, or homicidal ideation. And her eating habits have suffered. Doesn't eat as much as she probably should, not due to disordered eating or an eating disorder, but more to a lack of resources and access to food. And so what has been done so far, she was referred to campus-based counseling services, primary care through an FQHC that would take Medicaid, which can be a major issue at times. With additional counseling, case management, and psychiatric services. She was referred for domestic violence, community resources for housing and other community-based housing resources, as well as the food bank on and off campus. And the counseling center is the only other entity on campus that is involved with this individual.
Okay, thank you, Susie. So one thing excuse me, forgot to bring up, and Susie brought it up, was that Carla and Susie will be split in the two breakout rooms. So you will have reference to the discussion topic. So you just don't have to remember everything she just said. So there will be that. Carolyn will be in one room. I'll be in another. We'll give everybody a 2-minute warning when we get close to getting back into the room. So just be on the lookout for that. It'll pop up on your screen. But we'll go ahead and give it, I think we give it probably close to 15 minutes here, and then just come back for a quick recap. But just be on the lookout for the messages, and just give me 1 second to get everybody where they need to go. Okay, looks like everybody is back. Well, I think let's open it to the group, to each group. How do we feel about the discussion and some of the takeaways? Do we, one would be, do you like the breakout room flow as far as having two? Were there too many people, things like that? And then any other comments you might have, just go ahead and unmute or put them in the chat. Silence means we're probably going to keep doing it. Let's put that as well. So if nobody has any comments, I will say for our group, a lot of great comments, use of the chat, people unmuting more than in the main room. So hopefully that happened in the other room. Carolyn, is that true with okay.
Yes, it felt easier to have a discussion with a smaller group.
I have to
Good deal.
agree. It was very
Good.
easy.
Okay. We'll keep doing that then. Please keep providing the feedback too. If there's anything else we can do to enhance it, just let us know. We're up for it. As Carolyn put in the chat, next session's on April 4th. If anybody has a topic discussion they want to submit, please do so. We are still looking for one there. We might have the one that was scheduled for today. Hopefully they can do it in April, but just in case, go ahead and submit something. And if there isn't anything else, and all the links and everything like that will come in the recap email. So I see that Susie put the link in there. So you'll get those as well as the evaluation survey. So be on the lookout for that, and we'll see you next time. Take care.